Hello, trust you're having a good day. So, at the root of most health condition, I found that the digestive system has a big place to play. In fact, it's just at the root. That's where it all starts from, and that's why in my consultation session, one of the major things that I do is to enlighten people on their diet and how to take care of the digestive system. But on that, I want to talk about something very basic. So I see people coming with constipation issue. So in the first place, some people don't even know that they have constipation, and constipation is really bad. So and what's constipation? Constipation is when you find it difficult to go to the toilet. Yes. So even if it's every day, but you have to do a lot of force before you can get it out. That's one. Two, it's also when you don't go to the toilet regularly. Maybe you're going 2 3 days before going to toilet. That's also constipation. And now there are many things that can cause it, but if you're experiencing it, you must deal with it. You must not leave it, because you know what happens when you do that. You are leaving at the end of the day waste that you're not able to get out of your body. In simple terms, bacteria will feast on it and create more toxins in your body. So you don't want, and of course that was start an inflammatory response from your body. So you don't want to really do that. You want to take it. So, but this video, I just want to basically talk about some of the things, habits, or things that we are doing that causes constipation. So one at the top of the list is you are dehydrated. That means you're not drinking enough fluid, enough water, or food that contains water. That's one. Two, you are eating food that are very low in fiber, or maybe no fiber. So if you're eating processed food, you're not eating enough original food and vegetables and fruits. That can also cause it. Lack of physical activity too will cause it. So sitting down, especially for our modern day work now, where we sit down for long and not move. We start our day in the morning, we don't do a lot of activity, we sit down in one place. That would also cause constipation. So you want to move your body. Now we also have medications. So we have different kind of medications that can cause it too. So I'm going to be listing some of them. We have pain medications, especially those that are narcotic. We have antacid. Now a lot of people that say they have ulcer, and every time they're using antacid, it doesn't only cause constipation. And I'm sure in other videos I'll talk about the danger of antacid. So antacid that contain calcium and aluminium most likely will cause constipation for you. So we also have blood pressure medications. We have anti-Parkinson drugs. We have antispasmodic drugs that are we have antidepressants, and we have iron supplements. So when you're using iron supplements, you need to watch out for constipation issues. We have diuretic, that's medicine that help remove fluids in the body. Then we have anticonvulsants. Then we have milk. That's an interesting part here. So milk, yes, milk we hit it. So a lot of people that take a lot of milk, this is for you. And milk does not only cause constipation, milk causes allergy and many other things. One of these days I'll do a video on milk so that we'll know what we're taking before we start taking it. We also have a condition called irritable bowel syndrome. Of course, when you're pregnant, you can experience constipation. If you're abusing drugs, laxative, that's like you now start using laxatives, that's drugs that help you go to toilet. If you keep using them, before you need to start having constipation, because it will not work. Then when you feel the urge to go to the toilet and you hold it, that also can cause. So when you feel like going to the toilet, better go. But if you hold it, you are creating constipation for yourself. So we also have specific health conditions that can cause it. Of course, stroke, multiple sclerosis, conditions that make your potassium levels low. We have diabetes, kidney disease, hypothyroidism, pituitary disorder, problems with the colon and rectum, and of course that's where you have irritable bowel syndrome. We have diverticulosis, we have colon cancer. So you need to check, of course, this last set, before your body gets to that place, you must have abused it. So basic things are, watch out for your fiber intake. Watch out, because even whatever the cause is, one of the ways you have to fix it is to make sure you start taking enough fiber and drink enough fluid. So these two things. Then reduce your milk. Especially milk are more for children. If you are grown up, you should cut. In fact, look for plant-based milk. That's what you should use. That's my recommendation. If you have to take milk, take it as yogurt. Greek yogurt, not sweetened yogurt. Okay, so these are, I made this list so that you can watch out which of them you are doing that is making you have that constipation, so that you can stop it. Because of course they are natural treatment, but the major thing is to stop the cause, to understand the cause and stop it, because constipation is going to create bigger problems for you. So, and because of my experienced in the consultation room, some big issues or some complicated issues that people have started with constipation. So take your health in your hand. You know, I believe in prevention. That's why I come out and tell you this kind of things. So prevent further problem by dealing with constipation. I've also done videos that talks about Himalayan salt helping with constipation, you know. So take heed. See you in my next video. Bye.